Welcome back. It's amazing how fluid science can be. Many of the experts who called for lockdowns, vaccine mandates and widespread mask use now acknowledge that those measures will do little to curb the spread of COVID-19 and that all restrictions have a long list of unintended and often terrible consequences. The world-leading scientists behind the Great Barrington Declaration, who were maligned and slandered by the media for challenging the madness of locking down society to tackle a respiratory virus, well, they've been vindicated. The data continues to roll in, and study after study shows that lockdowns that were embraced by nations who abandoned their advanced pandemic plans to follow China's COVID strategy, those lockdowns represent the greatest public policy disaster in living memory. One of the three authors of the Great Barrington Declaration, Dr Jay Bhattacharya, a professor of medicine at Stanford University, who was scathing of lockdowns and the damage they cause at a time when public health officials were calling for ever stricter restrictions. Well, I'm pleased to say Dr Jay Bhattacharya joins me now. Doctor, before we get down to the lockdown lunacy, there's a worrying study from Thailand that I want to ask you about. It shows at least 1 in 6 and perhaps as many as 1/3 of teenagers have had side effects after a second dose of the Pfizer vaccine. Now, Reuters has tried to do a fact check on this study, and they say that the study of 301 teens in Thailand found mild and temporary heart rhythm changes after a second dose of the Pfizer vaccine among 1 in 6 teenagers, not 1/3, as social media post claims. 1 in 6 is still fairly worrying. Last year, a major study showed that teenage boys were up to 6 times more likely to suffer from heart problems from the vaccine than be hospitalised from COVID-19. Jay, 1 in 6 is concerning, this Thailand study. Has there been enough research into the impact of COVID vaccines on teenage boys and young children?
That study, even if you take it at its most conservative, you say one male was hospitalized for myocarditis. Well, it's 1 in 300. That is an incredibly high rate. And the benefit to the boys themselves from getting the vaccine is low because the death rate from COVID in that population, thank God, is really, really low. On net, I think this is a very concerning study.
That's. I just hope there's a lot more research into this. That seems absurd to be leaving this to this fairly small Thailand study. Now, you face some malicious attacks from the media and lockdown enthusiasts in public health for arguing for focus protection. Do you now feel vindicated?
I mean, it's a sad vindication, Rita, because so many countries, Australia included, paid the cost of the lockdown and nevertheless have had the cost of COVID. You know, I think Australia now has more total cases per capita most of them have been accumulated just over the past few months over the entire pandemic relative to the United States. More cases in Australia per capita than the United States through the whole pandemic. And that despite Australia locking down repeatedly during the pandemic. It's been sad to watch from the outside because Australia has paid the harms of the lockdown over and over, but also has had to face tremendous harm from COVID itself. The only saving grace is that when these cases arrived in Australia, most of the vulnerable elderly had been vaccinated. And so the rates of death have gone lower per case, which is a good thing. But at the same time, why wasn't this done a year and a half ago? Why did you have to face a year and a half additional lockdowns? When the vaccines first arrived, that is when Australia should have opened up after having vaccinated its elderly.
Well, we do have a very high vaccination rate, but we still have experts in this country calling for further restrictions. There are still recommendations that children be masked in school in states like Victoria. It's still mandatory to wear masks on planes in Australia. And yet some public health experts want stricter measures yet. Jay, again, why are these experts just ignoring the data and hanging on to this lockdown obsession?
I think the problem is that they have a monomaniacal focus on COVID alone and they do not, for whatever reason, see the harms that lockdown does to the mental health of populations, the physical health of populations. People, when they live in a state of anxiety caused by the lockdowns, are hurt. Children are hurt, especially by these lockdowns. And I think the problem is you have a class of experts who just have a very narrow scope, a very narrow view, and do not think that anything other than COVID is worth worrying about, that somehow COVID is a unique danger to human health and human well-being, when in fact there are many dangers and many problems in human health well-being. Public health, a good public health, takes a much broader view than these experts do.
Well, do you think we've learned our lessons now? Has the West learned, or if we have another pandemic, are we again going to make the same mistake, follow the Chinese Communist Party strategy of locking people down? Have we learned our lessons, Jay?
I think that hangs in the balance, Rita. I think that is something that should be at the forefront of every democratic society's political discussion going forward until it is resolved that we never lock down again, that lockdown is a dirty word. The political leaders that pushed lockdown, no matter, I believe, whether on the left or right, should face some consequence for it, electoral consequence, where just as, for instance, the Iraq War, the leaders who pushed the Iraq War in 2003, they faced electoral consequences. The parties that pushed them faced electoral consequences. Those same consequences, similar consequences, should be faced by the parties, again, of no matter which on the left or right push these lockdowns, until every party agrees that these lockdowns were a complete and utter disaster, just as you said, Rita, and that we never consider them again. Right now, it seems to me it hangs in the balance. It could go in either direction, but I think a political movement needs to be built around this anti-lockdown position.
Dr. Jay Bhattacharya, thank you so much for joining me tonight. Professor Jay Bhattacharya will be in Melbourne next month. To hear him speak, go to drjayinoz.com. And the Australian government recommends vaccinations for all Australians aged 5 and over, as it is effective at reducing severe illness, hospitalisation and deaths from COVID. Coming up next, a shocking case